Hello, everyone, and welcome to this Biosample Hub webinar on the subject of managing the shipment of biological resources. And the speaker is Romain Belot, and Romain has a master's degree in health engineering and biobank management from Université Catholique de Lyon. He was an operational and quality manager at the Centre de Ressources Biologiques, CRB Santé, of CHRU de Brest, where he worked to prepare and obtain ISO 9001 and ISO 20387 certifications. Romain has also worked as a consultant for a large pharmaceutical company in France, where he managed the import and export of biological resources. And in this presentation, we're going to take one example in order to keep it as simple as possible. And that example is a French biobank sending biospecimens to a biotech company in the USA. So we're not going to talk about sending samples in the other direction. We're not going to talk about South America or Africa or the Middle East or Asia or Australasia. All of that will be for future webinars. Okay, so with that, I'll pass over to Romain.
Thank you, Robert, for the introduction, and thank you everyone for attending this webinar. So I will present you how to navigate the regulations for a shipment of biological resources. And just like Robert said, I will mainly cover the USA regulation and the European and especially the France regulation around it. So just to start, I will speak about the data protection. So in the European regulation, we have the General Data Protection Regulation, the GDPR, who govern the right over the data protection. So as you may know, that the data concern everyone. So a person can be identified from a single piece of data. So from his DNA or from a social security number, but also with a cross of reference of set of data. So with a date of birth or an address, for example. For the GDPR, the personal data is an information relating to an identified or identifiable natural person. So it means that a person can be identified either directly by his surname, for example, or indirectly with a mobile phone or a biometric data, for example. So the GDPR mentions that the processing of personal data is an operation or a set of operation relating to personal data regardless of the process used. So it can concern the collection, the recording, the organization, or the storage, for example. So an important note is that the personal data processing is not necessarily computerized. It also concerns paper files. So the paper files must also be protected under the same conditions as the computerized files. Another note is that the data processing must have a purpose. So you can't collect or process personal data just in case it might be useful one day. There must be a purpose. And obviously it must be legal and legitimate regarding to your professional activity. So any organization, regardless of its size, country of establishment, and activity may be concerned by the GDPR. So the GDPR applies to any organization, public or private, that processes personal data on its behalf or not, provided that it is established in the territory of the European Union or its activity directly targets European residents. The GDPR also concerns the subcontractors who process personal data on behalf of other organizations. So if you process or collect data on behalf of another entity, you have specific obligations to guarantee the protection of the data entrusted to you. So, of course, the data applies if the biospecimens or biological resources are linked to identifiable personal data. You must get an informed consent from individuals, of course, and in case you are sending a biospecimen to a country outside EU, there are you have to be adequate with the data protection. So there are specific mechanisms to be compliant with it. So according to the GDPR, the contractual clauses ensuring the appropriate data protection safeguards can be used as a ground for data transfer from the EU to third countries. So that include the model contract clauses, the standard contractual clauses, the SCCs, that have been pre-approved by the European Commission. So the SCCs are there to ensure that the personal data transferred to a country outside EU has the same level of protection as in the EU. Also, all the data transferred must be pseudonymized and anonymized. So that's it for the general data protection in the European Union. Now I will focus on the French part with the CNIL, so the French Data Protection Authority. So it is responsible for ensuring the protection of personal data contained in computer or paper files and their processing. So it is responsible for ensuring that information technology is at the service of the citizen and that it does not infringe on human identity, on human rights, and on their privacy. So the CNIL has the role to alert, to advise, and to inform all audiences, but, and importantly, it also has the power to control and to impose sanctions. So in France, it oversees with the GDPR, the protection and the data anonymization of all sensitive health data. And before transferring a biological material to a non-EU country, the CNIL will require documentation. So it includes the SCCs I mentioned before, but also the BCR, the binding corporate rules, which are internal policies adopted mostly by multinational companies to govern the transfer of personal data across border within the same corporate group. So it means when you have to transfer data from one entity to another entity in the same group, but in different country. So it's there to be sure that the data are protected with the same level of protection. Just below, I added the Article 8 of the protection of personal data from the Charter of Fundamental Rights of the European Union. It's just to have a general idea about the data protection, so I will make it brief, but everyone has the right to have their personal data protected. All the data must be processed fairly and with a purpose, and everyone has the right to access their data and to obtain a rectification if it's necessary. And to be compliant with all these rules, you may be subject to a control by an independent authority. So in France, it will be the CNIL, but in other countries, it will be other authorities. Now that's the general idea. How does it work in France to get to be compliant with the regulation? So you have to make a declaration of conformity procedure. So in France, we are using the reference methodologies, which are simplified procedure to access the health data. So the reference methodology applies to the studies who require the personal access to health data, and the reference methodologies set out an exhaustive list of conditions that must all be respected. In particular, regarding the data controllers, the objective pursued by the processing, the personal data concerned, the duration of the data retention, the recipient of the data, the information of individuals, and the respect of the data protection and freedom rights. So we have 6 different reference methodologies. The first 3 one will concern the research involving the human beings, so the RIPH. The MR01 concern the interventional RIPH and the research requiring the performance of an examination of genetic characteristics. The MR02 will concern the non-interventional studies of the performance of in vitro diagnostic medical devices. The MR03 will concern the research involving the human in a particular non-interventional research. There are the next 3 MRs concern, as you can guess, the research not involving humans. So the MR04 is dedicated to the studies that fall within the competence of the CESRES. So the CESRES is an ethics committee. It will issue an opinion on the methodology chosen, on the need to use the personal data and the relevance of this data in relation to the purpose of the processing, and sometimes about the scientific quality of the project. MR05 and 06 are very specific because they concern the access to PMSI data. So the PMSI data are the Medical Information System program. So it refers to the data collected and managed under this program, which is designed to monitor, to analyze, and to improve healthcare system in the French for the French hospital, basically. So I said that there was only 6 MRs, but in fact there are 8 MRs. The 2 last one are very new because they came up this year, and they are just like the 05 and 06, very specific, but I think it's still worth mentioning in case you are concerned by it one day. So the 07 and 08 will concern the access to the public health data. So the 07 will concern the organization of with the implementation of research or study are necessary for the performance of a mission of public interest, and the 08 will concern the organization where the implementation of research or study are necessary for the pursuit of a legitimate interest.
Okay. Excuse me, Romain, could I
Yes.
just ask a question, really, just for clarification? Um, so, in France, CNIL is an organisation whose role it is to enforce GDPR, and uh, if you are wanting to send biological samples from France to another country, you must communicate with CNIL. Is that correct?
Absolutely. You have to go on the website and to make this declaration of conformity procedure and use the correct reference methodology I just described before.
Right, right. And CNIL has the power to impose fines, for example, for people who
Yes,
do not
yes. Hmm.
follow these regulations.
Absolutely.
Right.
So you have to make sure to be compliant with it.
Right. Okay. Okay. So I think that in of course in other countries there'll be different authorities that have the same role, and for example in Spain there's the Spanish Data Protection Agency, and in the UK there's the Information Commissioner's Office, which serves this role as well. Yeah. Okay. Thank you very much.
Yes, thank you, Robert. No, it's so yes, keep in mind that all these authorities will govern the right over the data protection alongside the GDPR. So now, regarding the biological sample themselves, about the France regulation, in case you are importing or exporting biological materials, you will have to get an authorization from the French Ministry of Higher Education, Research and Innovation. To get this authorization, you will need several documents. So firstly, you will need a cover letter, which must be signed by the representative of the organization, and preferably written in French because it can gain you some time. So in this cover letter, you must write the title of the study. You must describe a bit about the protocol and the context and the purpose of the study. And if you are concerned, if it is about a study involving the human being, you must specify the RPH level, so 1, 2, or 3. You also need to complete the import-export authorization application form. So in this one, you will need to add some information, some administrative information, for example, the address of the company, etc. And you also need to specify some information about the study itself. So for indeed the duration of the study, and also you will need to write the type of samples you are receiving or sending. You also need the sworn statement or an affidavit. So in this one, it must be written that the donation was done unpaid, that the consent from the donor have been obtained, and that the donor was anonymized. And this affidavit must be signed by each entity concerned by the collection of the human biological samples. And lastly, if it's applicable, so in case you are in a study involving the human being, if it's an RIPH1, you need to attach the opinion of the INSM, which is the National Agency for the Safety of Medicines, and the CPP, which is an ethics committee. So in the USA, for example, it can be the Institutional Review Board, the IRB. If you are concerned by RPH 2 or 3, you only need to attach the opinion of the GCPP. And to get this authorization, you need to send all these documents through one email.
Right. Again, can I just ask for a bit of clarification? In this slide, you're talking about a regulatory agency called the Ministry of Higher Education, Research and Innovation, and they are responsible for ensuring that you comply with the French Public Health Code. Is that right?
Yes,
Okay.
exactly.
So the French Public Health Code covers issues like the consenting of samples for research.
Yes, that's right. There is a huge part about the ethics part about the collection of biological samples.
Right. Okay. Okay. And so in other countries, there will be different agencies that take on this kind of responsibility. So, for example, in Spain, it is the Ministry of Health. That's the regulatory agency, and they monitor compliance with the Spanish biomedical research law. In the UK, it would be the Human Tissue Authority, which is the equivalent um, regulatory authority, and they monitor compliance with the Human Tissue Act.
Okay, thank you. That's good to know. So one last thing about the French regulation, I forgot to mention that. So you might wonder what are the delay to get an answer, to get the authorization about the biological sample. So regarding the data protection for with the CNIL, you have a maximum delay of 2 months. I mean, if you don't receive an answer below 2 months, it means you have an approval from the CNIL. For the biological sample with the Codeco service in France, it can take up to 3 months. So lastly, it was more around 1 month. I mean, even less than 1 month, but it can vary. It depends on the period. So if you really want biological samples and don't want to waste too much time, try to anticipate it as soon as possible. So now that's it for the European regulation part. I will now cover the US regulations. In Europe, we have the GDPR. In the USA, we have the HIPAA, so the Health Insurance Portability and Accountability Act regarding the data protection. So the HIPAA will describe the lawful use and disclosure of the protected health information. So if a biospecimen includes personally identifiable health information, the PHI, the receiving US company must comply with the HIPAA. If a US company processes PHA, a business associate agreement, a BAA, is needed to define the responsibilities for protecting the health information. So a BAA is a legally binding contract between a healthcare provider and a third-party service provider that handles the protected health information, the PHA. So to have a general idea about the HIPAA standard, I will describe two of them, but it's pretty similar to the GDPR. So firstly, I will briefly talk about the privacy standard. So there are privacy rules that establish the national standards regarding the protection of PHA. So to be compliant with this standard, it means that the patients must have the right to access their health records and request correction if it's needed. There are limitations on the use and disclosure of PHA, and it requires patient consent or authorization for most uses and disclosures of their information. About the security standard, there are security rules will establish standards about the protection of the electronic PHA. So it means that there must be a physical safeguard to protect the facilities where the ePHA are stored. There must be a technical safeguard to ensure that the ePHA are encrypted, and there must be an administrative safeguard. So it means that there must be a risk assessment, workforce training, access control, and in case of a data breach, a contingency plan. So that's it for the data protection. Now I will be talking about the biological sample regulation. So if biospecimens are used for clinical trials or research relating to a drug or device development, the US Food and Drug Administration, the FDA, will monitor the compliance to be sure about the safety and the ethical standards are upheld. So the biospecimens involved in the development of biological products must follow the FDA's good laboratory practice and the FDA good clinical practice standards. So to have, once again, a general idea about it, regarding the good laboratory practice, so you need to have a clear and detailed plan outlining the objective, the method, the analysis of the studies. All the personnel must be qualified. You have to have an appropriate facilities and equipment. All aspects of the study must be documented accurately, including the raw data, the observations, and the results. And you must also have an appropriate quality assurance and data management. Now, regarding the good clinical practice, you must get an informed consent from the patient. You must follow an ethical conduct. Of course, all the investigators must be qualified, and you have to have an appropriate to be sure about the data integrity. So how does it work if you want to be compliant with this regulation? So all the products must be declared to the US Customs and Border Protection, the CBP. So there are 5 different partners government agencies that may ask you documents or permits, but depending of the biological materials. A very important thing is that it is the importer who is responsible for complying with the conditions of the permit and how to deal with it, because there are a lot of biological materials and a lot of different documents. So you might be lost at first, but hopefully the licensed customs broker exists. So you can go on the CBP website, the US Customs and Border Protection website, where you can find a list of all the licensed customs broker. So you can find their location, their contact, and you can find the one you are the more interested in, and they will assist you by submitting all the necessary entry information and all the appropriate payment to the CBP on behalf of the importer, so you.
Romain, could I just ask, whose responsibility is it to communicate with these different agencies in the States? Is it the responsibility of the biobank in France that's sending the samples over, or is it the responsibility of the company in the USA which is receiving the samples?
Okay, that's a very good question. So as I said, it is the importer which is responsible to be compliant with all the conditions.
So it's up to the company.
Yes, in that case, it will be the company receiving the samples.
Right. Okay. Okay, so they need to get in contact with a broker, a customs broker, is that right?
Yes, unless they know perfectly what to do. But I mean, it's the easiest way to be sure to be compliant with it.
Okay, thank you.
So now, the general ideas about the import regulation in the USA. So, if the biospecimen present potential public health risk, import permits may be necessary either from the Center for Disease Control and Prevention, the CDC, or the US Department of Agriculture, the USDA. If the biospecimen must be properly declared upon the entry into the US and complying with any relevant sanitary and health regulation. I will briefly be talking about the transport regulation itself. So I know I spend a lot of time talking about paperwork, but it's very crucial in it. And I think most of you already know about the transport regulation. So there, the IATA dangerous goods regulation. So I will just be brief just to make sure that I will mention it, but I won't detail it too much. So the International Air Transport Association Dangerous Goods Regulation sets standards. So basically for biological resources, there are two categories. Category A, which are the specimens that can cause severe life-threatening diseases for the human, and the category B, which concerns the less dangerous specimens that only require more basic safety measures. So the biospecimen must be packaged in accordance to the IATA regulations, especially for the category A. So the packaging must include the triple containment, and depending on whether the specimens are infectious or non-infectious, different labeling and documentation might be necessary. So I am thinking, for example, about the UN code to be sure that everyone involved in the transport are aware of what's inside the package, and it won't harm anyone. Now regarding the export control from the USA, so keep in mind that the biospecimen may be classified as dual use, so it can be used both by civilian and military purposes, and the export control must be observed. So exporting specific biological materials may require a license from French or EU authorities. The Bureau of Industry and Security oversees the export of certain sensitive biological materials. So they have a list of all the sensitive biological materials. And the idea behind it is to be sure that these sensitive biological materials don't fall into the wrong hand. So yes, basically these regulations are here to prevent the misuse and mitigate biosecurity risks. So here I added a non-exhaustive summary about a French biobank sending samples to US pharmaceutical company. So you can use it to have a general idea about what to do, and it might be useful. That's it for the biological human resources. Now I will be talking about the non-human biological resources, non-human genetic resources. So this one, the main actor about it will be the Nagoya Protocol. And one of the main principles of the Nagoya Protocol is the access and benefit sharing. So the Nagoya Protocol governs the transfer of non-human genetic resources. So it can be plant or animal DNA, for example. All entities must comply with this protocol because it mandates agreement with the country of origin regarding the use and distribution of benefits derived from these genetic resources. When transferring a non-human biological resources for commercial or research purposes, an access agreement with the country of origin will be necessary to ensure the fair sharing of any resulting commercial or scientific benefits. The sovereign nations control the access to their genetic resources, and because it can play a role sometimes, the related traditional knowledge around it. So the access between the providers and the users of genetic resources is firstly subject to prior informed consent, the PIC. So the PIC refers to the agreement granted by the country from which the genetic resources are obtained before these resources can be accessed and used by the user. So the consent is granted after providing the party is fully informed about the purpose, the scope, and the potential uses of the genetic material. The access between the providers and the users is also governed by mutually agreed terms, the MAT. So the MAT refers to the terms and conditions agreed upon by both the provider and the user of the genetic resources before the resources are accessed or used. So it will define the scope of use. So it means that the parties will agree on how the genetic resources will be used. It will also define the benefited sharing. So it means that the term it must include how benefits because how it benefits because it can be monetary or non-monetary. Uh, so how these benefits will be shared between the provider and the user. The MAT should also specify that both parties will comply with the national and international legal requirement regarding the access and use, once again, and it must also define the duration and the territorial limits about genetic resources. So I write it, but that's the main idea about the Nagoya Protocol. The use of genetic resources must ensure the fair and equitable sharing of benefits.
Okay.
So now,
Sorry, could
yes.
I just ask, can you explain a little bit why this is relevant to hospital biobanks and to companies that are involved in medical research? Why would they need to know about the Nagoya Protocol?
Well, so this part might not concern everyone for sure. So about the hospital, I'm not sure they are involved about it, but for a pharmaceutical company, they can be using plant or animal samples.
Okay.
And for to get this sample, they must be compliant with the Nagoya Protocol.
Right, right. And would it apply to, for example, microbiome samples, do you think? Or
Yes, it might. Yes.
okay, and would it apply to laboratory mice, for example?
Well, all animal samples. So it might be.
Okay, so people doing work with xenografts and it would be relevant to them.
Exactly.
Okay.
So uh, that's the idea around the Nagoya Protocol and the access and benefit sharing. Now, how to proceed to get non-human genetic resources. So you can go on the access and benefit sharing clearinghouse website, where you can find indeed a lot of information, and you can find a world map just like I put just below. So there you can find all the country that signed or ratified or are non-party of the Nagoya Protocol. So you can choose the country you are interested in and find a lot of information. So especially the ABS national focal point for each country. These are the contacts you need to know everything about how to get the genetic resources. So what will be the what will be the so you sorry, I really need to get it. I lost myself, sorry. Um, so the IBS national focal point is the contact you need to reach in case you are interested in certain non-human genetic resources. I will just finish regarding a general shipment regulation. So this one will concern the MTA, so the material transfer agreement. So it concerns both human biological sample and non-human genetic resources. So the MTA must define the content and the scope. So it shall outline and define the purpose, the scope, and the terms of the biospecimen transfer. So Inside, it should be covering the intellectual property, so to identify the ownership of the specimen and any product derived from them. And it also should include the use restrictions, so detailing the permissible and prohibited uses of the biospecimens. So that's it for me regarding the shipments regulations. So just there, I added some websites so you can try to go on them to have more information. So just a quick note, MES3 goes for it's the French ministry regarding the biological material regulations. So thank you all for listening to this webinar and feel free to contact me if you have any question.
Okay, well, thank you very much, Romain. I'm sure that many people will find that very useful information, and thanks for a great talk. Um, could I just ask you, after hearing of this all the details of this complicated process, um, can you advise biobanks that have not shipped samples overseas before? What would be the best way to start to go about this? Would you recommend that they um, try to do it all by themselves, or engage a shipping company to guide them through the process?
It depends of the shipment itself. So it's if it's an European biobank who must send samples for outside Europe, of course they will need some help. So if it's sending to the USA, as I said, you might get some help with the license customs brokers. But regarding the French, I mean, let's say it's a French biobank, they will need to complete themselves the biological sample regulation regarding the exportation of their samples. So as I said, it's not very complicated, but it's complex. So there are a few documents to fill the information. You just need to be sure to gather all information and to send it to the French ministry. From then, you should be compliant with the regulation. Also, you need to be sure about the data protection. So from this part, yes, it will be the biobank role to be compliant with it. Then regarding the transport regulation, you might get some help by other company who will take care of the shipments of biological products.
Okay, and then for the process, once the sample reaches the USA, that the responsibility for taking care of that is lies with the importing
Exactly.
agency. Okay, and so there'll need to be a close communication between the biobank and the company.
Well, there might need some information, so you will still be in contact. But they will be, because they are receiving the sample, they are the importer, they will be the one to be sure to be compliant with the US regulations. Yes.
Right. Okay, great. Okay, thank you. Could you just say a little bit about what are the major tasks in terms of time and difficulty for a biobank in France shipping the samples, or for a company in the US receiving the samples? What would you say are the major tasks in terms of time and difficulty?
Mm-hmm. From my experience, so here I present the general ID, the the regulations. Sometimes it can get more complex regarding certain situation, but it's always very specific. So it's hard to describe one, but what helped me a lot was to be in contact with the national authority. So me, I was in contact with the French ministry who helped me to be sure to be compliant with the regulation. Another difficulty that might happen, as I said, is to be sure to anticipate everything as soon as possible, because sometimes you might need to get sample as soon as possible. So try to gather the information while you can and send it. Keep in mind that it can take some time to get the approval. Sometimes it can take up to 1 month. So if you need it for the next week, it will be very short. So let's try to anticipate it.
Great. Well, thank you very much, Romain.
Thank you, Robert.
Thank you.